Imagine a disease so prevalent that it affects 1 in 10 adults worldwide. Yes, a disease that is so widespread, it affects an astounding 10% of the global adult population. This isn't a hypothetical situation or a theoretical threat that we're discussing. No, we are referring to very real and very pervasive problem of chronic kidney disease. Chronic kidney disease, or CKD for short, is an epidemic, albeit one that is often hidden. Silently, with little warning or fanfare, it affects millions upon millions of people all around the globe. Many of these people are entirely unaware that they are suffering from this condition. It's a discrete disease without apparent symptoms until it has already progressed significantly. This disease is indiscriminate in its victims. It does not care about your age, your race, your socio-economic status, or any other demographic factor you can think of. Chronic kidney disease can and does strike anyone and everyone. It's a long-term condition in which the kidneys, vital organs for our health and survival, don't work as well as they should. CKD is not a static disease. It's progressive, deteriorating over time. It's a silent attacker, showing its true colors only when it has advanced significantly. This makes it all the more dangerous, as it can go unnoticed for a substantial period, causing irreversible damage before its presence is even detected. Often, CKD is caused by other serious health conditions such as diabetes and high blood pressure. These are conditions that, in themselves, constitute severe health risks, but they also pave the way for the of CKD. Yet, despite affecting millions of people globally, chronic kidney disease is rarely a topic of conversation. It's not the subject of high-profile campaigns or celebrity-backed charities. The silence around CKD is deafening, and yet this silence is very much part of the problem. The lack of awareness, the unknowing suffering of countless individuals, is a substantial part of what makes CKD such a dangerous disease. However, it's important to note that just because CKD is not in the limelight, doesn't mean it's not a major health concern. In fact, CKD is the 9th leading cause of death globally. Such a statistic should be enough to shock us into action, but often, it is not. It's easy, all too easy, to overlook or underestimate CKD. Part of the problem is a lack of awareness and understanding. Many people aren't even aware they have it until their kidney function is significantly impaired, leading to CKD often being referred to as the silent killer. But we're here to break that silence, to expose the truth about chronic kidney disease. Video, we will delve deep into the realities of CKD, what causes it, how it affects the body, the long-term implications for those who suffer from it. We'll explore the cutting-edge technology and revolutionary preventative strategies that offer a ray of hope for kidney patients. We're not just here to the problem, but to provide solutions, to offer hope to those living with CKD and those at risk. Because knowledge is power, and the more we know about this disease, the better equipped we are to fight it. We will arm you with knowledge, with understanding, and with hope. We will shed light on a disease that has lurked in the shadows for far too long. We will make clear the real impact and implications of CKD. We will explore the advancements promised to protect kidneys and dramatically improve the quality of life for those affected. Now that we've grasped the magnitude of this issue, it's time to delve into what chronic kidney disease really is. Chronic kidney disease, often abbreviated as CKD, is a silent killer that operates beneath the surface. This vast medical issue is a hidden menace, working behind the scenes, secretly and gradually diminishing kidney function over time. In the world of medicine, it is known for the stealthy way it progresses, causing serious harm to individuals if not detected and treated in a timely manner. CKD is a condition that subtly reduces kidney function over an extended period. This process, often unnoticed at first, can eventually lead to total kidney failure if overlooked or not properly managed. The silent progression of the disease is what makes it especially dangerous, as its effects can potentially be life-threatening if it reaches an advanced stage. Now, you might be wondering, what are the key factors that contribute to the development of chronic kidney disease? The primary culprits are typically common health conditions such as diabetes and high blood pressure. These are not the only factors, but they are often the most prevalent in patients diagnosed with CKD. Both conditions can cause significant damage to the blood vessels in the kidneys. This damage compromises the kidney's essential function, which is to waste from the bloodstream efficiently. But it's not just diabetes and high blood pressure that can lead to CKD. There are other factors at play too. These include genetic predispositions, wherein a person is genetically predisposed to developing kidney disease due to their genetic makeup. Certain autoimmune diseases are also instrumental in the emergence of CKD. These diseases cause the body's immune system to attack its cells, which can include the kidneys. The symptoms of chronic kidney disease are often subtle, further adding to its stealthy nature. These may include fatigue, loss of appetite, nausea, and changes in urine output. As the disease advances, the symptoms more severe, with patients experiencing swelling in the ankles, vomiting, shortness of breath, and persistent itching. This wide array of symptoms can easily be mistaken for other conditions, which can lead to delays in diagnosis and treatment. The disease progression of CKD is typically classified into 5 stages. These are based on the level of kidney function, or more specifically, the glomerular filtration rate. Stage 1 signifies minimal kidney damage with normal or high filtration. In stark contrast, Stage 5, also known as end-stage kidney disease, indicates a severe decrease in kidney function, leading to total kidney failure. The impact of chronic kidney disease extends far beyond the physical symptoms and complications. It also takes a substantial emotional toll on those diagnosed with the disease. Patients often grapple with feelings of anxiety, depression, and chronic stress due to the uncertainty and severity of their condition. Furthermore, CKD presents a considerable financial burden. Costs associated with the disease include ongoing treatment, medication, and potentially even loss of income due to the debilitating effects of the disease. The financial implications of managing CKD can be as significant a challenge as the health implications, adding to the overall adversity faced by patients. Understanding the disease is the first step towards combating it. Knowledge is power, and in the case of CKD, it is a vital weapon in the battle against this silent killer. But what if there was a revolutionary technology that could change the game? In the face of CKD, medical science has not remained idle. The relentless march of innovation has brought forth an illumination of hope in the form of a groundbreaking new treatment. This particular medical advancement does not represent a mere subtle tweak or a minuscule improvement on existing methods. Quite the contrary. This is a game changer, a comprehensive paradigm shift. Imagine this, a compact medical device not much larger than an ordinary smartphone. This device doesn't just stand idly by. It actively monitors your kidney's functionality in real time with the efficiency of a dedicated personal healthcare assistant. It constantly generates feedback, providing you with an up-to-date overview of your health status. This is not just a concept or a fantastical idea from the realm of science fiction. This is a tangible reality, a living, breathing innovation that is currently transforming lives today. This device efficiently functions by meticulously analyzing vital indicators in your blood. It promptly alerts you of noteworthy changes that could potentially signal an underlying problem, serving as a much-needed early warning system. The internal mechanics of this device might seem complex, but the core principle is simple. Early detection equals early intervention. It provides an in-depth look at your kidney function with level of detail far surpassing traditional blood tests. It's comparable to having a team of microscopic doctors vigilantly monitoring your kidneys, ready to raise the alarm at the earliest indication of a problem. But the benefits of this technological marvel extend well beyond early detection. This device also guides treatment strategies, aiding medical professionals in tailoring your care based on the real-time data it gathers. This data-driven approach can lead to noticeable improvement in kidney function, a significantly reduced need for dialysis or transplantation, and ultimately, a vastly enhanced quality of life for patients. And the best part? This device isn't shackled to the sterile environment of a hospital or a clinic. Portable, user-friendly, and meticulously designed to seamlessly integrate into your everyday life. You can carry it with you wherever you go, ensuring that kidney care becomes a proactive rather than a reactive process. This revolutionary technology does not spell the end of traditional treatments. Instead, it offers a powerful new tool in the fight against CKD, early detection. It's a testament to the power of innovation, to our unwavering determination to improve the lives of those living with chronic kidney disease. But remember, while this technology is groundbreaking, it is not a panacea. Prevention remains the best cure. As we move forward in our exploration of this innovative device, let's also look at how we can implement preventive measures in our daily lives. So let's delve deeper into this topic and explore how you can put this time-tested maxim into practice and give your kidneys the best chance of staying healthy. While this technology is groundbreaking, prevention remains the best cure. So let's delve deeper into this topic and explore how you can put this time-tested maxim into practice and give your kidneys the best chance of staying healthy. Prevention is undoubtedly the most effective weapon we have in our arsenal against chronic kidney disease, commonly known as CKD. Now, let's take a deeper, more extensive dive into the numerous strategies and measures that, when implemented correctly, can significantly help in preventing CKD. The first strategy that we need to consider is our dietary habits. The food we consume plays a vital role in our overall health, and when it comes to the kidneys, a kidney-friendly diet brings about impactful change. This diet typically includes foods that are low in sodium, potassium, and phosphorus. You might be wondering why? Well, these elements, when consumed in excess, can put extra strain on our kidneys, leading to potential damage. By consuming a diet low in these elements, we are giving our kidneys less harmful substances to filter out, thus enabling them to function more effectively. Adding fresh fruits, vegetables, and whole grains to your meals can also be incredibly beneficial. These foods are rich in vitamins, minerals, and fiber, which aid in maintaining a healthy body and, by extension, healthy kidneys. However, it's essential to keep in mind that everyone is unique, and what works for one person may not necessarily work for another. This is where consultation with a dietitian or healthcare provider becomes invaluable. They can create a diet plan tailored to your individual needs, factoring in your overall health, lifestyle, and any underlying health conditions you may have. Next, let's talk about hydration, another critical aspect of kidney health. Water assists our kidneys in clearing sodium, urea, and toxins from the body, which in effect dramatically lowers the risk of developing CKD. But the big question is, how much water should one consume daily? Unfortunately, there's no one-size-fits-all answer. The amount of water you need to drink depends on several factors such as your overall health, how active you are, and the climate you live. However, a general guideline suggests aiming for at least 8 glasses of water per day. This can vary, and staying well hydrated is the goal. Moving on to lifestyle changes, regular exercise, maintaining a healthy weight, and avoiding harmful habits like smoking can considerably reduce the risk of CKD. Exercise is particularly beneficial as it helps control blood pressure and lower blood glucose levels, 2 factors that are key in preventing kidney damage. A lifestyle often leads to obesity and other health issues that can contribute to CKD. Hence, staying active should be a priority. Lastly, proper medical management is another strategy that plays a significant role in preventing CKD. Regular checkups and constant monitoring of kidney function can help detect any potential problems early. Early detection of any abnormalities can lead to early intervention, and this increases the chances of preventing further damage. If you have underlying conditions like diabetes or hypertension, managing them effectively is of utmost importance. This might involve taking prescribed medications, making lifestyle changes, or both. Remember, it's essential to use medications as prescribed to avoid causing harm to your kidneys. While prevention is key, it's also crucial to be aware of the common causes of kidney injury. We will continue to explore these causes and delve into deeper details in our upcoming scene. Stay tuned as we uncover more about this important aspect of our health. While CKD can be a silent disease, kidney injury often has clear causes. It's akin to a tempest that doesn't gently seep in with tender whispers, but loudly announces its presence with a reverberating thunderclap. Although this can be disconcerting, fear not, because the weapon we all have is knowledge. Today we're on a mission to arm you with that very knowledge. So let us delve deep into understanding the usual suspects responsible for kidney injury. Among them, overuse of NSAIDs or non-steroidal anti-inflammatory drugs is a significant factor. These are the everyday painkillers and fever reducers that we rely on. Despite their effectiveness in providing temporary relief, their excessive use can mount a ferocious attack on your kidneys, compromising their function and health. Then, we have another foe, and that's infection. On many occasions, bacteria and viruses can launch an aggressive campaign against your kidneys, inflicting injury. This is where the importance of maintaining good hygiene and preventing infections comes to the forefront. Moreover, there's the exposure to toxins and harmful substances, which can hold your kidneys hostage. These toxins might come from various sources, including our food, water, or even the environment in which we live and work. So the question that naturally arises is, how can we safeguard our kidneys from these threats? The answer starts with the safe and responsible use of medications. Always adhere to your doctor's advice and refrain from self-medication. It's crucial to remember that even a minor deviation from the prescribed dosage or frequency can have major repercussions on your kidney health. Next on the list is the significance of hygiene and the prevention of infections, which cannot be overstated. Routine practices such as regular hand washing, avoiding close contact with individuals who are ill, and keeping your vaccinations up to date can serve as a sturdy line of defense against infections. We must also address the elephant in the room, which is environmental and occupational hazards. If your job involves exposure to harmful substances, make sure you're equipped with the appropriate protective gear. While it may seem inconvenient at first, your kidneys will definitely appreciate this precaution. In summary, the struggle against kidney injury isn't waged on a far-off battlefield, but within the realm of our daily choices and habits. It revolves around being conscious of the medications we consume, the hygiene practices we maintain, and the environments we expose ourselves to. Avoiding kidney injury is half the battle won, but let's hear from those who've already triumphed. In the next segment, we'll share heartening stories of individuals who've navigated this journey victoriously. Stay with us, as their narratives may serve as the beacon of hope you've been searching for. Nothing speaks louder than success. That's why we're going to share some inspiring stories of people who have successfully navigated their journey with chronic kidney disease, thanks to the new technology and prevention strategies we've discussed. Let's dive into their heroic journeys. First, there is the remarkable story of Jane. Jane found herself facing an unexpected diagnosis of chronic kidney disease in her mid-30s. Confronted with this reality, her world was thrown into a state of chaos. The potential risks and complications associated with the disease seemed like insurmountable hurdles. She was terrified, but Jane was not someone who could be easily defeated. Instead of succumbing to the fear, Jane chose to face her illness head-on. She embraced the progressive technology we previously discussed and set her focus on making significant lifestyle changes. Jane started by overhauling her diet, integrating more kidney-friendly meals. She began exercising regularly, making it her mission to stay as healthy as possible. She dedicated herself to learning about her disease and utilizing every tool at her disposal. This determination paid off. Today, Jane's kidney function has improved dramatically, and she no longer requires dialysis. Her story is one of courage and determination. Then we have Robert. Robert was born into a family with a history of kidney disease, and he was adamant that he would not become another statistic. From a young age, Robert developed a proactive attitude towards his health. He was mindful of his diet, choosing kidney-friendly foods, and made regular exercise a priority. He took every possible measure to maintain his kidney health. When he was diagnosed with early-stage CKD, it was a setback. He did not let it discourage him. Instead, he saw it as a challenge to overcome. He turned to the new technology for help, and with his consistent efforts, Robert saw great results. Now, Robert is leading a healthy life, with his kidney function within normal range. His story serves as an inspiration for those who are trying to prevent the disease. Last but not least, there's Emily. Had been living with chronic kidney disease for over a decade, depending heavily on dialysis. It wasn't easy for her. She struggled, she fought, but she never gave up. When the new technology was introduced, it gave Emily a new lease on life. It offered her hope when she needed it the most. Today, she's not just surviving with CKD, she's thriving. Emily is a testament to the power of perseverance and hope. These are just a few of the countless success stories out there. People from all walks of life with varying stages of CKD have seen a dramatic improvement in their quality of life. They've taken control of their health with the help of innovative technology and effective prevention strategies. Jane, Robert, and Emily were once overwhelmed by their diagnosis, but they found strength in knowledge, hope in technology, and resilience in prevention. They have shown that chronic kidney disease doesn't have to define your life. Their stories are proof that with the right resources and a determined spirit, one can overcome even the most challenging obstacles. These stories are a testament to the power of prevention and new technology in combating CKD. They stand as the living embodiment of triumph over adversity, of hope over despair, and of life over disease. Let's now turn to the experts, the ones leading the fight against CKD. The foundation of our understanding and our approach to managing chronic kidney disease, commonly referred to as CKD, is based on the expert insights of several medical and healthcare professionals who tirelessly work at the front line of this escalating health crisis. These are the nephrologists and renal specialists who dedicate their lives to studying and understanding the complex workings of our kidneys. They spend countless hours working towards diagnosing and treating CKD, armed with an unrelenting determination to curb this largely preventable disease. The importance of prevention is a consistent theme in their discourse. They constantly stress on the necessity of catching this disease in its early stages for effective treatment and management. They understand the significance of staying alert and vigilant, of recognizing and acknowledging the very first signs of this seemingly silent killer. They also speak with immense optimism about the latest advancements in kidney care, breakthroughs that are transforming the way we approach and manage CKD. New treatments are emerging, cutting-edge technologies are being developed. All these advancements are revolutionizing the field of nephrology and giving us invaluable hope. Then, we engage with the nutritionists, the dietary experts, who comprehend the intricate relationship between what we consume and the state of our health, especially our kidneys. These experts hold a deep understanding of a kidney-friendly diet. They stress the significance of being mindful of our food choices, of understanding what we should include and exclude from our plates. They share invaluable tips for meal planning, for dining out, for making every bite count towards the nourishment of our bodies, and most vitally, our kidneys. We also hear from fitness experts who join the conversation to underscore the importance of regular physical exercise in maintaining kidney health. They educate us about the types of exercises that are most beneficial for our kidneys, the ones that aid in managing weight and preventing obesity. They reiterate the fact that while our diet plays a crucial role, it's only one component of a much larger puzzle. An overall healthy lifestyle, one that includes physical activity, is equally pivotal in the fight against CKD. These expert perspectives, these nuggets of wisdom, they paint an illustrative image of the path we need to tread to safeguard our kidneys. They emphasize the fact that prevention isn't just about avoiding the disease, but about creating a lifestyle that fosters overall health. It's about making informed and conscious decisions that honor and support our bodies, that empower us to live our best lives, even in the face of CKD. The battle against CKD is one we must fight, but remember, knowledge is power. So let's harness this knowledge, leverage these expert opinions to fuel our battle against CKD. Let's use this wisdom to protect our kidneys, to build a healthier, brighter, and more promising future for us all. Let's work together to win this fight against CKD, and in doing so, ensure a better tomorrow for generations to come. We've covered a vast amount of territory today, ranging from understanding chronic kidney disease, commonly known as CKD, to delving into prevention strategies. This exploration has guided us through the shrouded epidemic that is kidney disease, its warning signs, and the symptoms. We've looked into the impact it has, not only on individuals, but on the lives of millions of people globally. Chronic kidney disease remains a significant challenge in the medical world, affecting a significant portion of the population, often unbeknownst to them. We've carefully peeled back the layers of CKD, revealing its insidious causes and the numerous risk factors that can increase its likelihood. Our journey has illuminated the limitations of the current treatment options available, laying bare the pressing need for more effective solutions. We've also encountered some of the cutting-edge technologies that are taking the medical world by storm. These advancements, revolutionary in their scope and promise, bring a glimmer of hope, offering the potential for improved kidney function, reducing the need for aggressive treatments like dialysis, or also brought to light the beacon of hope in the form of groundbreaking advancements in technology that promise improved kidney function, significantly reduced need for dialysis or transplantation, and a vastly improved quality of life for those suffering from CKD. The importance of prevention in our battle against this disease has been stressed repeatedly. Our journey has taken us through the significance of a kidney-friendly diet, the essence of remaining hydrated, the need for regular physical exercise, and the importance of keeping up with routine medical checkups. Furthermore, we've delved into ways to avoid kidney injury, including the safe usage of medications, critical preventive measures against infections, and reducing exposure to harmful substances. We've heard heartwarming and powerful success stories from individuals who have reaped the benefits of these new technologies and prevention strategies. We've also gained valuable insights and advice from leading experts in the field: nephrologists, kidney specialists, nutritionists, and fitness experts. Their vast knowledge and experience have further underlined the significance of incorporating kidney-friendly habits into our daily lifestyle. But let's not forget, this journey isn't merely about information gathering. It's about taking decisive action, making necessary lifestyle changes. Staying vigilant about your health status and proactively protecting your kidneys is crucial. So, let's take a moment to revisit what we've learned. Understand the problem at its core. Explore the exciting new technologies in the medical field. Implement the outlined prevention strategies rigorously. Share inspiring success stories to motivate others. Seek expert advice to stay informed. And most importantly, take proactive and deliberate steps to safeguard your kidney health. The fight against CKD, remember, starts with you, with every little step you take. Knowledge is power, and staying informed is the first step towards staying healthy. Therefore, stay tuned for more updates on medical breakthroughs, kidney health tips, and stories of resilience and hope in our continued fight against chronic kidney disease. Remember, the fight against CKD starts with you, so stay informed, stay healthy, and stay tuned for more updates on medical breakthroughs and kidney health tips.